on the different dosage forms of drug. Have you ever wondered how different drugs exist in different forms, from tablets to pills to different formats? You may wonder why that paracetamol, for example, can exist in both pills, liquid preparations, or even injectables. Now, dosage forms are the physical forms in which these drugs are presented. They are the physical formulation of drugs. The reason why drug exists in different dosage forms is for mainly two reasons. The first one being stability of the drug, to ensure that the drug is not degraded before reaching its targeted site of action. And most times for convenience. Don't mind my spelling, guys, but some people don't like taking tablets. Some people like taking liquid preparation of drugs. Some, because of some different reasons, just stick to a particular dosage forms of drugs. There are other reasons also why drug exists in different dosage forms or different physical chemical properties based on that particular characteristics of that drug. Now we are going to be looking at the dosage form of drug in four different categories. Drug exist in different dosage forms based on their route of administration. I did a video on route of administration. The link will be in the description. You can check the description, or by the end of this video, you're going to see a video on route of administration in pharmacology fully explained. These are the passage in which drugs enter the body. So most times we formulate this drug in different physical form based on which route they are administered in terms of safety and efficacy. The first one is the oral route. So there are some drugs that are given orally. This includes your tablets, your pills, your capsules, or even liquid preparations such as your suspensions, solution, mixture, tinctures, and the likes. The next one is going to be the drugs that are given via the rectum. This includes enemas and suppositories. Some drugs are, however, given through the respiratory passage or they are inhaled. This includes your inhalers, so they are drugs that are given by the inhalational passage or by inhalation. This includes your inhalers, your nebulizers, medical oxygens, and the likes. And also, we have drugs that are directly given into the bloodstream. In this case, the drug is bypassing the first pass effect. Don't forget that the first pass effect is the degrading of drug before reaching systemic circulation, before reaching the bloodstream. So drugs might be given directly into the bloodstream to ensure that its active property is still intact and it is not degraded before reaching the site of action. So we say these drugs are given parenterally or through the parenteral route of administration. And the last one, of course, is the topical route. It might not necessarily be skin, it might be any mucous membrane, mucosal lining, it might not be the integument, the skin itself, but it might be any topical opening. Now I'm going to be looking at different dosage form of drug in these five categories. The first one being the drugs that are given orally. Now, of course, we have two broad preparation of this drug. We have the solid preparation and we have the liquid preparation. The solid preparation of these drugs are drugs that exist in solid forms. They exist in solid forms, and this includes your tablets. Example is your aspirin tablets, your paracetamol, and the likes. They exist in compact form. So they are solid in physical property, they are compact, and of course, they are taken orally. We also have the capsule, or you can say the capsules. An example of this is tetracycline capsules. Different drugs exist in capsules, by the way, and these capsules are basically drugs that can decay or they can disintegrate due to exposure to air or in contact with water. So they are enclosed in a shell, and this shell is basically or commonly made up of gelatin, and of course they can come in different forms and different colors. Other solid preparation of drugs include the powdered form and the granules. Now, the powdered form and the granules are basically the same thing, just depends on how finely grinded or how finely should I say, let me use the word finely grounded they are. For the powdered form, and a popular example we know is the ORS, the oral rehydrated salt that you can dissolve in water to rehydrate yourself in the case of dehydration. And we have the granules. The granules exist in tiny balls. So let's say about 2 to 4 millimeter of diameter. They can also dissolve in water. An example you can see here in this picture is sodium citrate granules that you dissolve in water and is given orally. These are the solid preparation of drug amongst other examples such as pills and the likes. Now let's move over to the liquid preparation. Don't forget, these are the solid preparations of drug that are taken orally. The liquid preparation of drugs are those that exist in liquid forms. They are taken orally, of course, and an example is the suspension. Now, the suspension consists of the drug. So I'm going to be referring to the drug itself as the API. The API is the active pharmaceutical ingredients. So the drug that is the API dissolved in a suspending agent. Suspending agent could be water. So this drug is just left to be suspended in water or any other suspending solution. And of course, for suspension, you will shake well before use. We have different kind of suspension. We have cough suspensions. We have um, antibiotics in suspension formats. Though stability about this particular drug is of a major concern. Another form of drugs are those that exist in form of emulsions. Emulsions is basically you taking two immiscible substance and making them miscible by the use of an emulsifying agent. Of course, example here we can see is the cod liver oil that is made up of different um, substance being homogenized and emulsified by an emulsifying agent into a single whole. And other examples that you can also consider is, apart from the cod liver oil, is the castor oil emulsion. The next we are going to be looking at are the solutions that you can take orally. Basically, a solution is any solute dissolved in a solvent. So substance dissolved in water, and we know water to be the universal solvent. So most drugs are dissolved in water or dissolved in salt solutions. And we also have the syrup. The syrup is of a very good example, especially for children that don't like the taste of bitter drugs. So syrup can be mixed with any sweetened substance such as sucrose in order to max the bitterness of various drugs. We have linctus. Linctus also we have we can see is any API or of course API active pharmaceutical ingredients or any drugs of medicinal value that is mixed with any sweetened substance, sweetened or flavored substance to max the taste and the like. So and basically you have found in our cough syrups, we have codeine, linctus, and the likes. And the next liquid preparation we are going to be looking at that are given orally or that are taken orally in their dosage forms is the tincture. Tincture. So here we have a tincture. A tincture basically is an API in very low concentration that is being dissolved in either alcohol or hydrochloric acid. Here we can see an example is the iodine tincture. We have 2% weight by volume of iodine being dissolved in 70% volume by volume of alcohol and purified water. Most times you use alcohol, sometimes we use hydrochloric acid. Now, these are drugs that exist in this dosage form, liquid preparation or solid preparation, that are given orally. Liquid prep. Now, let's look at other forms of drugs and their route of administration, other dosage forms. We're going to be looking at, of course, the ones that are given directly into the bloodstream, as they are given through the parenteral route, and they includes the vials, they includes the ampoules, I hope I'm spelling ampoules correct, the injectables, the IV bag, the perfusion bag, infusion bag, IV bags, and the likes. You can see this is the IV bag. This is an injectable. This is a glass ampoules, vials, and the likes. Now, the next dosage form of drug we are going to be looking at again is those that are given into the rectum, via the rectum, into the rectum. We have the suppositories and we have the enemas. The suppositories are basically a confined or hardened aqueous substance. It might be oil based, it might be water based, but they are very lipid soluble in order to be absorbed into the walls of the rectum. They're very lipid soluble, so they can be given directly into the rectum and they are being absorbed into the walls, bypassing the first pass effect. So they are directly absorbed into the bloodstream per se. And we have enemas. Enemas are solutions, liquid solutions, or solutions. Here we can see this particular hose is injected into the rectum, and this aqueous solution, it might be in form of a suspension or an emulsion, is adsorbed directly into the rectum. And an example here is the prednisolone enema, of course, has anti-inflammatory properties. And in the case of severe vomiting, severe nausea, that you can't really give drugs orally because the patient will actually vomit the drug, you know, the patient will regurgitate the drug out. You want to give into the rectum. So this particular dosage form are very, very suitable, especially for drugs that are anti-emetics. The next dosage form we are going to be looking at are those that are given topically. Now, topically in this case might not just be the skin that you can see. It might be the skin membrane, it might be a mucosal lining, such as the vaginal walls or lining of the nasal mucosal lining, the vaginal mucosal lining, the lining of the throat. It might be even the lining of the eye, that's the cornea. Any form of opening, any form of topical opening or mucosal membrane, any form of mucous membrane. I hope I'm spelling this correctly. Any form of mucous membrane, that's where we give all these dosage form. We have our creams in different containers. We have our ointments or lotion. They are basically oil based. We have our mouthwash. We have our eye drop. We have our lozenges, especially for those that are given to suit the lining of the throat or the lining of the nasal cavity, right? Lozenges. And we have those that are given, you know, for vaginal use only, that dissolve. They act like suppositories, but they are a little bit different because these ones are acting on the mucosal membrane. So we have the Charis. Yeah, Pizarris. I hope I'm pronouncing that right. Now let's move over to the next dosage form of drug, and we are going to be looking at those that are given into the respiratory passage, that's they are given by inhalation. We have the nebulizers, we have this is the spray, and we have of course our aerosol inhalers. For the nebulizers, there are different gases that are given into this pressurized container via an oxygen mask. uh, in the case of prepping for a surgery, anesthetic gases and the like. So I can say a laughing gas, nitrous oxide, or I think NO2, and laughing gas given by this route, an example of drugs. And for sprays, spray are basically any form of drugs that you give in a minute manner. You spray it directly into your nose or directly into your throat, you know, anything that can get to the nasal passage. And here you can see that there is a tiny opening. So this tiny opening acts as a control or as a regulator to allow little dosage of this drug into the respiratory tract. So it acts as an atomizer. Or you can also call this entire container an atomizer. Now, for the aerosol inhalers basically is when we have this gas or these gases alongside other inert gas with the active pharmaceutical ingredient, such as the API, of course, the active gas that has pharmacological effect, being pressurized into this aerosol container. And they are now being released in this metered valve. They are being released in this metered valve. That is why we can see in this case salbutamol. Salbutamol is used for asthma patients. And we can see that here it says 200-meter dose. You have to shake well before you use. So these aerosol inhalers or these aerosol containers enables drugs that are given to the respiratory tract in the appropriate dosage form to be released through meter valve. And that is all for the dosage form of drug. Though we have other dosage form, but these are just the most important ones and the most common ones you need to know in pharmacology. Let's take on some clinical questions. Question 1 says a patient with severe nausea and vomiting is unable to take oral medications. The doctor wants to give an antiemetic with systemic effect. Which dosage form is the most appropriate in this situation? Of course, you can see here that we need an antiemetic drug with immediate systemic effect since the patient cannot take any drug orally. Is it A, oral syrup, B, rectal suppository, C, chewable tablet, D, bucafin? So the answer, of course, is rectal suppository since it is for antiemetics. And of course, we need systemic effect immediately. Question 2 says a patient requires rapid relief from an acute asthma attack. Which dosage form and route combination provides the fastest onset of action for a bronchodilator like salbutamol? Is it A, oral tablet, B, metered dose inhaler, C, transdermal skin patch, D, enemas? Of course, we need a fast onset of action for a bronchodilator. The patient is having an acute asthma attack, and drug, of course, is salbutamol. So answer is going to be an inhaler, metered dose inhaler. Now, I want you to look at this last question. A child refused to take tablets. Which dosage form is most appropriate? I want you to comment your answer and comment your reason why for this particular question. Now, if you have found this video helpful for dosage form of drug in pharmacology, do well to like, subscribe, and share.